I'm Dr. Shakiba at Women Pelvic Surgery. It is always a very tough decision for patient to make a decision to proceed with surgery. But unfortunately, sometimes surgery is the best option to proceed. I'm making this video to answer some of the common questions my patient ask on every day and daily basis. This video is for my patient undergoing robotic surgery for pelvic pain, endometriosis, abnormal uterine bleeding, partial hysterectomy or myomectomy for fibroid, or most common procedure we do, which is for pelvic floor dysfunction. The surgery is done robotically with the use of 3 incisions only. It is very rare that we have also additional 4 incisions. Usually we use the belly button as one of our incisions and 2 additional incisions on the side. The length of surgery depends on complexity of it, is 2 to 3 hours. And patients usually have a very minimal bleeding. 99% of our patients go home either same day or next day. Once the surgery is booked, we guide you to speak to my surgical coordinator. She's gonna give you all the instruction. Usually you're gonna need to come to the hospital to do a blood test prior to surgery, and also on certain patients, they need to have a medical clearance prior to surgery. As far as what medication you should take prior to surgery, not to take, usually most of medication are allowed to be taken up to day before surgery unless is mentioned otherwise. What is very important, our blood thinner definitely need to be stopped. You need to make sure you do not eat or drink after midnight prior to surgery. The day of surgery, you show up 2 to 3 hours prior to a scheduled surgery at the hospital. After meeting the anesthesia, you're gonna undergo the surgery. After surgery, I'll talk to your family member. After a couple of hours, you're most likely allowed to go home. However, if you have pain or if you desire to stay one night overnight, is no problem. You can stay one night. When you go home, you need to make sure when you get in the car or out of the car, you do it very carefully. I encourage you to rest, not to do heavy activity first night, but you're okay to go to bathroom. The next day, you can have regular food as tolerated and activity as tolerated. We encourage you to walk, but nothing extensive. You can shower, make sure you're not rubbing around your incision. If you're having constipation, it is okay to take stool softener such as Colace 100 milligram once or twice a day. The day number 2, usually the pain is significantly less. I would say 60 to 70% of our patients, day 1 and day 2 only take Tylenol and ibuprofen, but we always prescribe Percocet as needed. The very important rule is things should get better, not worse. If anything go against that rule, you should call us. Any fever, chills, or anything unusual, feel free to contact our office. As far as pain goes, the same rules apply. The pain should get less and less. If the pain gets worse, you can always feel free to call us. By day 5, you may be able to drive. All activity should be not extensive, no heavy lifting, not more than 10-15 pounds. And we usually see you 2 weeks after surgery. Thank you.